Good afternoon, everyone, and welcome to the California Immunization Coalition Education Hour. I'm going to give you a moment or two while we let everybody come in, and then we'll get started. All right. So good afternoon, everyone, and welcome to the California Immunization Coalition Education Hour. All attendees will be in listen-only mode. If you need technical assistance, please use the chat box on the bottom right of your screen. A link has also been sent out in the chat box to all participants that can help troubleshoot any technical difficulties. During the webinar, you're welcome to ask questions, and you can do so by typing them in to the question box or the chat box on the lower right of your screen. Questions will be answered at the end of the presentation. Now introducing your host and moderator, Meg Dorsey.
Thank you, Cameron. Good afternoon, everyone, and happy holidays. I'm Meg Dorsey, a CIC board member and chairperson for the CIC Education Committee, and I will be your moderator for today's call. We have a robust audience today, including many school nurses and other advocates for children's immunization. And the CIC Board of Directors wants you all to know how much we value and appreciate all your efforts and expertise on behalf of immunizing children. The California Immunization Coalition hosts education hours throughout the year on immunization-related topics to help our colleagues stay up to date on important news and information. And while there are always many hot topics in the world of immunizations, school law and its implementation are always of great interest. There have been many changes in recent years, and today we have a very interesting program for you, which will address several of the recent changes. This program will be especially useful for school nurses and public health professionals as we shed some light on new procedures for addressing medical exemptions and the importance of immunization assessment and reporting for schools. We anticipate many questions, so please feel free to submit questions throughout the program via either chat or the question box, as Cameron mentioned. This will allow us to organize and consolidate your questions, and we will, as Cameron mentioned, address all questions for all speakers at the end of the program. Also, following today's webinar, a recording will be available on the CIC YouTube channel, which you can access via the immunizeca.org website. If you are unfamiliar with this new feature of the website, please check it out. Today we are so fortunate to have two very knowledgeable speakers, and I would like to introduce them to you now. Ms. Pamela Kahn and Dr. Joan Edelstein. At the end of the program, we will also have the good fortune to hear from Kristen Finch of the California Department of Public Health. Ms. Kahn is the Coordinator for Health and Wellness at the Orange County Department of Education. She's been a credentialed school nurse for more than 20 years. Pamela has provided leadership for health programs improvement by developing strong relationships, collaborating and planning with the community at large, including public and private community agencies, as well as school district leaders. Ms. Kahn is the immediate past president of the California School Nurses Organization and a board member of the California Immunization Coalition. She's a member of several professional organizations, including the California School-Based Health Alliance and the National Association for School Nurses. Joan Edelstein holds a doctorate in public health and a master's degree in nursing. She is currently an instructor in the school nurse credential program at Sacramento State and is the faculty of record for the Community Health Services Policy course. Ms. Edelstein is a strong vaccine advocate, and she has been active in supporting California Senate Bill 277 and Senate Bill 276 as a member of the very important advocacy group Vaccinate California. Dr. Edelstein teaches school immunizations and assists school nurses in implementing school vaccine mandates across the state. She is an active member of Nurses Who Vaccinate, as well as the California School Nurses Organization. And again, as I mentioned, at the end of the program, we'll hear from Kristen, who will provide an overview on resources available for school reporting. Ms. Kahn will be our first speaker today. So Pamela, please begin your presentation.
Hello, everybody, and thank you for joining us. We have about 250 on the call right now, and it's still climbing. So we are pleased that as a board member of the California Immunization Coalition, I'm speaking for them. We are very pleased that we are able to offer this topic, which obviously is of great interest to all of you. And I would like to echo Meg's comments regarding the value and how CIC advocates for school nurses and values so much their contribution, evidenced by having a nurse on their board. They always have school nurses in their thoughts when they plan projects, decide which laws to advocate for, et cetera. And I, for one, am very grateful for their support. All right, so today we're going to get started and talk about schools and school nurses' role in medical exemptions. As many of you know, there was recent change, and from the questions that I get, I certainly realize that not everybody is quite up to speed on the law, and it can be very confusing. So we hope to get you through this today and have you come out the other side with some more tips, hints, and knowledge about this. So with that, let's take a look at what the objectives are for today's presentation. So upon completion of this webinar, hopefully, attendees will be able to describe the rationale behind SB 276, which was authored by PAN, and that law was entitled Immunizations, Medical Exemptions. Identify available resources that may be used for immunization assessment, reporting, and medical exemption management. Determine the value of tracking immunization data. And also formulate communication strategies for use with parents around the issue of medical exemptions. And may I add other quarrelsome topics that we are certainly facing today. We're going to give you some communication tips that should help in many areas. Next slide. I'm going to go a little bit over the history and legislation of what is behind what we're talking about today. So many of you who've been school nurses for a while remember back in 2015, PAN authored Senate Bill 277, which eliminated personal belief exemptions. We had been seeing quite a large climb in personal belief exemptions throughout the state with a couple outbreaks. I know in 2009 we had H1N1, we were seeing more measles, certainly in California and around the nation. Mumps was starting to rear its head again. So given those conditions, it was recognized that personal belief exemptions were perhaps contributing to the rise of these once fairly much eradicated contagious diseases. So PAN wrote this bill to eliminate personal belief exemptions. When it had passed, the required vaccines increased from 92.8% school-wide. As many of you know, we turn in kindergarten immunization data at the beginning of the year, midway through the year for the school year. Usually around December, it's been going in maybe January. It was 92.8, and once SB 277 passed, we went up to 95.1% rate of immunizations across the state in only 2 years. Of course, medical exemptions subsequently increased from only 0.2% to 0.7%. So while that sounds like a small amount, that translated into a 250% increase in medical exemptions. And we weren't terribly surprised at that. A lot of us who work in the school setting were recognizing that we were getting quite a few questionable medical exemptions. I know in my experience, we were seeing exemptions that were authored by certain physicians, and they were identical for every child that brought one in. The wording was identical. There was no clear medical history, no clear medical condition, et cetera. So we started to raise some concerns with the CDPH about these medical exemptions that we were getting. However, at that point in time, there wasn't anything in place, or not much substantially in place, that we could do to combat these or question these or invalidate them. So in 2019, PAN again was working on our side on this and authored Senate Bill 276 and Senate Bill 714, which gave the California Department of Public Health authority over medical exemptions. Previously, it had really been up to the school districts. We oftentimes would check with CDPH on what we should do, or if we had a question about an exemption. But this law in 2019 gave CDPH the authority to okay medical exemptions and or revoke medical exemptions. Those of you who've worked for a while again in school nursing certainly know about the CARE system, where we document our immunizations throughout the state. So in 2021, CARE ME, which is the CARE/medical exemption database, was created and went into effect on 1/1/21. And this is where medical exemptions are submitted and tracked, et cetera. CDPH also revoked medical exemptions from disciplined physicians prior to January 1st, 2020. Along with all of this medical exemption reporting and giving CDPH authority over them, the CDPH also said any medical exemptions who were written by disciplined physicians prior to January 1st, 2020 were no longer valid. Along with this, schools and school nurses, when we say schools, we usually know it falls to the school nurses when it's the area of immunizations. We're tasked with notifying parents about this. We had to let parents know how to go about obtaining medical exemptions in this new form. And we also have been tasked with initiating appeals requested by parents when the CDPH revokes a medical exemption. Some of you may not have known that. When I found this out personally, I was a little surprised that this would be put on school nurses, and I called up to my highest contact at CDPH and I asked, why are school nurses being asked to do this? First of all, given the current climate, we are, barely keeping our heads above water with COVID. And even when that ends and we get that under control, school nurses are not particularly invested in helping parents, for the most part, obtain medical exemptions. The CDPH explained to me that they felt it made more sense for the school nurses to do it because we at the schools have the whole histories of their immunization and possibly, hopefully, their medical conditions, et cetera. That, in other words, we were the keepers of the most information, so it made sense for the schools/school nurses to work with the parents to initiate an appeal to CDPH when a medical exemption gets revoked. So that's in a nutshell how we came to this point in time. I know that Joan is going to elaborate on many of these points and hopefully answer some questions. I did see one that came in quickly regarding students with IEPs exempt. That's very tricky. I don't know if Joan's going to address that. We could do that later in the questions, or you want to talk about that now, Joan, or are you going to talk about that in questions?
Sure, I can.
Thank you.
Yeah, so what had happened in the process of SB 277 going through committees before it went to the legislature for votes, it got stuck in the education committee when a question arose about students with IEPs, and nobody wanted it to die in committee. So there was language that was kind of compromise language that specifically said that students with IEPs would continue to receive services, that this legislation would not interfere with services. So to be very specific, it doesn't say anything about students with IEPs not having to have immunizations. It simply says they have to have services, which can be out of school often. And unfortunately, once SB 277 was passed, we were hoping to have direction from CDPH saying services, just services, and students still need to be immunized. And there was, just to go over quickly, CDPH first said, well, we don't really know about special ed. We're going to ask CDE what should be done. And we at Vaccinate California said, they don't know about immunizations. Your CDPH, you need to make the determination. And ultimately, because they felt uncomfortable with all of the laws around IEPs, they made the decision that each district legal counsel would decide how that was implemented in the school district. And so some school districts, like large ones like LAUSD, said, oh, well, students with IEPs won't have to provide documentation. And other school districts, many school districts, said, we've always excluded and required immunizations because communicable diseases don't know whether a student has an IEP or is a vulnerable student. And so we will continue to exclude and provide services. Ultimately, what happened is that CDPH added a category of students who have special needs that are not required to have documentation, which at Vaccinate California, and many of us who were school nurses were not happy with. Because although we now have one of the strictest immunization laws for schools in the country, it also means we're the only state who has with a category of students who are not required to be immunized. So that's the story about students with IEP. It's complex and it's not clear, and it changes from district to district. So one of the things I want to mention before I start is the first thing I need to do is acknowledge the outrageous workload that everybody has in the midst of a chaotic pandemic. Whoops, can we not go forward on the slides? Thanks. So nonetheless, I'm going to present this part separately as though we didn't have a pandemic. And the reason is I just want to focus on this law and recognize that even when the pandemic is hopefully over and we don't have another one on top of it, that we managed to avoid having another outbreak of any other kind, chickenpox, measles, or whatever it is, because we know that our kids are already behind on their immunizations, and it's so important to catch up and make sure as many students as possible are immunized. So again, please know that I'm saying all of these things with the understanding that you may not be able to do every single thing that we talk about, and please feel free to get support for that. But this is the ideal way of things that should be done. So the first piece is that there are two paths having to do with when an ME is needed or no longer valid. And this is important because there are parents, as well as school staff, school nurses, who are not fully aware of the difference. So first of all, there are medical exemptions that expire. And MEs will expire when the child enrolls in the next grade span. So if a child has an ME in preschool, when that child comes to TK or K, that child will need a new medical exemption. If a child had a permanent medical exemption before that child hits 7th grade, that medical exemption now expires and they need a new one. MEs also expire on the date that's specified on a temporary medical exemption, and any temporary medical exemption should have an expiration date. And then, of course, when there's permanent revocation of the exemption, that exemption expires. And that's what we're going to go into now. So next slide. Thanks, Cameron. We're going to focus on medical exemptions that are revoked. And this has been a huge challenge. So first of all, I'm sorry, yeah, can we just stick with this? Thank you. Medical exemptions that were written prior to January 1st of 2020 by any physician who has been disciplined for any reason. There's a common misunderstanding that it has to be a physician who's been disciplined for writing medical exemptions, and there are many. We will at some point try to narrow down that list for you, but any physician who's been disciplined for any reason whatsoever, any medical exemption they wrote prior to January 1st, 2020 are revoked. And that's a link to the letter and instructions, or just the letter, I think, the letter saying that they're revoked, that you got directed to follow. Medical exemptions written from January 1st, 2020 through December 31st, 2020, in other words, the whole year of 2020, are kind of up in limbo. Many people have asked, well, why not before January 1st, 2021? Senator Pan authored SB 276. There were amendments made at the beginning, at the last minute, without going into the political details. When the legislature was voting on it, it was close to going on the governor's desk. There were more amendments that were requested. Rather than amend SB 276, a partner bill, SB 714, was written quickly without the usual long time vetting of language. The partner bills meant that one was the amendments and that both of them had to pass in order for each of them to pass. If one of them didn't pass, neither did, both had to pass. There were conflicts in the language having to do with the dates of what was required when, and it's still not clear about the MEs written prior to the creation of the database after January 1st, 2020. Hopefully that will be clarified at some point. So one of the reasons we're going through this is that you might expect you will have to go back once more to revoke ones that are written in 2020, but we don't know. So we're looking at all medical exemptions prior to January 1st, 2020. We don't know about the year of 2020, and we don't worry about after January 1st, 2021, which is really great because CDPH is now in charge of approving or not approving medical exemptions that are submitted. So there's two different ways to look and determine if a physician has been disciplined. And I'll go through it after I go through the slide. We'll show you how to do that. There's a searchable list of disciplined physicians on shots for schools. And that list is from March 2021. So it's not totally up to date. The best and easiest way, in my opinion, to determine if a physician has been disciplined is to do a license search. And so I'll go through those bullet points in just a moment. So what we need to do is have the list first. There we go. Okay, so you get the list, and this is pages and pages and pages. There's thousands of physicians who've been disciplined. So you go to the search bar or the search box, and you put in the name of the physician. So we're going to put in Ron Kennedy because I know there's a discrepancy. And see what happens when Ron Kennedy's name is put in and the name doesn't show up on the list of disciplined physicians. Again, this is from March of 2021. So now let's go to the license search. What you're going to do, and this is already filled in, but I want to point out, under boards and bureaus, you're going to put in the Medical Board of California. And then the only other information you have to put in is the first name and last name. And Ron may not be his full name, but as long as you've got the first few letters, I would suggest for a common name like Kennedy, not just putting in the last name because you'll come up with a lot of them. And then you've got Ron Kennedy, and let's do a search. So there's a few Ron Kennedys, and it looks like the first one is the Ron Kennedy that we're looking for. Can we make that a little bigger? Can we go back for a second? Is there some way to make it a little bigger so people can see? The print is a little bit tiny because there are several Ron Kennedys. So that's okay. So let's just leave it as it is. Perfect. Okay. So before you go to the other slide, one of the things that this says is there's a physician and surgeon. Okay, it's pretty obvious if the license has been surrendered that he doesn't have a license anymore, but there may be something that says probation, you don't know, or it may be probation is finished, or there may be another term that's not clear. It's not your responsibility to figure out what each of the term means, but what you can do is on the right-hand side, click on more detail. And this is what it says. Here are the licensing details. And if you scroll down just a little bit, a little more, under public record actions, you can see number 1 is administrative disciplinary actions. Number is 1. So that tells you right there that the physician has been disciplined. So if you're not sure exactly what it means that the license is revoked or is on probation or is supposed to do this, that, or the other thing, just click on more details, look at the public record actions. If it says administrative disciplinary actions, and there's a number, you know that physician has been disciplined. Okay, let's go back to the PowerPoint. Thanks so much, Cameron. So this is how you do it. And let's just go to the next slide. So this is ideally what would be happening in the schools by the school nurses or nursing assistants, health clerks, administrative assistants, whoever is identified as responsible. We know that not all school districts have school nurses, but here is the plan of implementation. First of all, when it says prior to January 1st, 2020, that means to review every single medical exemption that was written prior to that date. We suggest, when that's done, making a spreadsheet or a document or some other way to keep track of the students who had medical exemptions, which ones were revoked, and then a list of students who have medical exemptions that were not revoked, even though you know this is written by a physician who's written loads of medical exemptions and wondering why that physician hasn't been disciplined yet. That physician may yet be disciplined, because last year we were looking, or even earlier this year, we were looking at somewhere between 5 and 7 physicians that we knew had been disciplined, had written a lot of medical exemptions. But for example, there was a doctor in San Diego who'd written something like 2/3 of the medical exemptions in the district who had not been disciplined. That has now changed. We're up to something like, I believe, 17 physicians who've been disciplined only for writing medical exemptions and writing too many. So the numbers are changing, and it would be super helpful to have a list so that you don't have to start from scratch and go back and know, okay, well, I can go through here and see if this physician has been disciplined. Very often it'll be, a physician in the area that you know is a competent, legitimate physician. There's only 1 or 2 medical exemptions because they'll be rare. I wouldn't worry about it too much. Feel free to look them up. But the concern is those physicians who are writing bogus medical exemptions. So you want to check each physician's name. It's easiest, even though there's a long, long list of physicians who have been disciplined, it's not totally up to date, but the search for the specific license will be up to date and is easy to do. So this was done in the spring with the idea that parents, families would be notified before school started so that everybody would be up to date and caught up over the summer, even though you weren't supposed to be working over the summer. So now, as we continue on, many of these have happened and they need to continue to happen. So once the physician's name is checked and you discover that the physician has been disciplined, or now you find out there's another physician who's been disciplined and you could go back to your list, you notify the family as soon as possible if the student's ME has been revoked. And try not to feel like, this is what I always envision, is that you now have a white t-shirt with a great big red target on you. You're going to provide notice of not more than 10 days to initiate the vaccination, just like you always do. If a student is unvaccinated, just let them know. But, and here's the big but, if a family says they want to appeal, they have 30 days from the date that you notify them. And during that 30-day time, the student may attend school. If the family wants to appeal, the school or the school nurse has to initiate the appeal form, and there's a link to the form with long directions and instructions, and it all goes through the online system. So we can go to the next slide. So the school or the school nurse initiates the appeal form because, as Pam said, but I'm going to reiterate, you have the accessible copy of the medical exemption, which CDPH doesn't have because it's been in writing and it's not part of CARE ME. And you know the date that you've notified them. It's not something that comes from CDPH. CDPH already said, these are revoked. When you discover that they're revoked, you are starting the timeline. Next slide. Okay, and we've been hearing from nurses across the state how difficult this has been, and we totally get the difficulties. So we want to address dealing with upset angry, frantic parents. They can be angry because of what's being done. They can be upset because they didn't expect it. They can be frantic trying to get another ME, which parents are not able to buy so much anymore, or frantic about getting their kids vaccinated and staying in school. So what you're going to do is provide information related to medical exemptions. The FAQs are available on Shots for School. This is a link. My suggestion to you is to try not to engage and maintain your boundaries. We all want to be helpful and we all want to support, but this is not coming from you. This is coming from the state. So a great way to go about this is to practice active listening, really listen, and validate their concerns. Things like, a motivational interviewing approach like we do with vaccine hesitancy, which Meg has been wonderful about describing. But validate their concerns. Yeah, a lot of parents are concerned about that. A lot of people have the same concern. I understand your concern. You don't have to fix it. Be clear that this is a state law and a state directive. It is not your decision. And if things start to escalate, feel free to refer the parents to your supervisor, the superintendent, whoever is appropriate in your district. But you are not responsible for handling all parents upset. All you can do is say, this is what I have to do. This comes from the state. It's not my choice. I'm happy to help you file an appeal. Next slide. So these are some links for communication strategies that may be helpful. And I have this particular note. These are really helpful communication strategies. And you'll have to, when you look at them, if you look at them, you'll want to look at them with the idea in mind that this is not something that happened during the school day or that you were part of decision-making process. You will find things that will say, apologize. You can certainly apologize. I'm sorry that you have to go through this, because that's legitimate to say. It doesn't mean I'm sorry that I did this, or I'm sorry our school district is doing this. It's just, again, part of active listening and responding and validating and being concerned. But as you go through these communication strategies, remember that this is a state law and a directive, and there are some things that you cannot fix. You will not be able to fix whether an ME is acceptable or not acceptable. And even if appeal, just so that you know, the only appeals that will be accepted is if are those for which the physician is not on the discipline list. If the physician's on the discipline list, the appeal is not going to be successful. And I just want to mention, take a few minutes on the next slide to talk about a few of the issues that have come up, just a select few that won't take time, because I could talk for an hour just about the issues that have come up. So these are just some sample situations, some quick responses, some not such quick responses. School nurses have been threatened with, well, if you don't take this medical exemption, I'm not going to enroll my child at your school. I'm sorry you feel that way, but there's nothing I can do about it. This child is in the 10th grade. Remember, we talked about expiration and revocation. Some parents are aware of the TK, K, and 7th grade expirations, but not aware of the revocations. So these are real examples. My child is in 10th grade. You have no right, I'm saying this nicely, it was really awful, to look at any student who's not in kindergarten or 7th grade. And I also often wonder about, school nurses have a hard enough time with this being attacked. I feel badly for front office staff who are being attacked like this, because they don't really have much to come back with. Not that school nurses have a whole lot to come back with, but yes, that there are two separate paths. We're not just talking about expiration when there's a new ME needed. All MEs written by any physician who was disciplined for any reason prior to January 1st, 2020 for a student in any grade, that ME is no longer valid. It's as though the student never had it. I'm going to call my attorney My response is always, I think that's a really good idea. Get them away from, let them talk to their attorneys, let the attorneys deal with it. That's not your problem. And then this is the actually in some ways more difficult one, because this is not where you're being attacked. This is where you're being asked for help. You always want to help parents. Okay, I'm going to get my child immunized. Do you know of any clinics or offices that offer cleaner or separated vaccines that don't contain aluminum adjuvants? Kaiser doesn't offer these safer versions, and I need to find safe versions of vaccines. First thing is, okay, Kaiser. This family has a provider. Direct the family to the provider. It's not your responsibility to find clinics or to find places that have mumps or measles vaccine that are separate, that are not used in the United States. It's not your job. You are already overwhelmed with a chaotic pandemic and trying to get kids immunized and up to date. Put it back on the parents. I don't have that information, but it would be a great idea to talk to your provider, and your provider can probably help. And if they don't want to help, that's not your problem. You, the school nurse. Okay, so next slide. What we're going to do, I'm providing in this slide my contact information. You should feel free to email me with any questions that come up after today, or issues of situations that you've been dealing with that you could use help with that can't be answered during the Q&A today. And so now that I'm 2 minutes early, I am going to turn this back over to Meg. Thank you.
Meg, you're on mute.
All right. Thank you so much, Joan. That was a wonderful presentation. Now we will hear from Kristen Finch. Kristen is the Population Assessment Coordinator at CDPH. She develops school reporting resources, supports local health jurisdictions, and prepares the school reporting data and the final summary report. Kristen holds a master's degree in public health and epidemiology from SDSU. So Kristen, thanks for joining us, and please begin.
Good afternoon, everyone. Thank you so much for joining. My name again is Kristen Finch, and I'll be pointing you through some resources that we have from CDPH, which is mainly the Shots for School website. Next slide, please. So I just wanted to share this diagram with you guys. This is the assessment timeline, and where does all of that data go that you are so diligently putting in every fall? So it starts with the IZ record, or the blue card, and you guys are maintaining this. And then in the fall, we submit our school survey. Eventually, we'll put up our state summary report, and we'll aggregate all of those numbers from the schools into county level data. And once that happens, we submit that data to the CDC, and that eventually gets published in the MMWR. Next slide, please. And so, Shots for School, you've heard it over and over again. This is the online resource that the state provides. Here you can see all updates to any changes in school reporting, and see links to where to report. Next slide, please. This is a very popular resource with our schools, especially the smaller ones. This is the Guide to Immunization Requirements. Because I'm the reporting person, I always have to point out that these boxes here are what's required for our checkpoints. And when I say checkpoints, I mean preschool and childcare. And then there's kindergarten and also 7th grade. This year, because of the pandemic, we have decided to include 1st and 8th grade reporting to help those students get caught up from the shortages from last year. Next slide, please. And so this is just a reminder that the blue card is online. And this is also our main resource for what we're reporting in our summary report. The status of requirements down there with the arrows, there is one for every cohort. Next slide, please. The middle of the page, you'll see the immunization reporting resources. In that little yellow box is our letter to schools, and we try to email this once our school reporting site is up to all of our school contacts. Unfortunately, we don't have a school reporting listserv that you can just sign up. We use our reporting contacts from the prior year. So anyone that was listed as the reporting contact when you reported last school year, those are the people that receive the communications. And if you're a school and you already know that that person has changed, you can go in and log into your school reporting account, and you'll be able to change your contact right then and there, and you don't have to update your report at the same time. So that's one way to update your new reporting contact for this year. But again, if you're looking for the school reporting site announcement, you can just always check shotsforschool.org. Once the moment it's open, we put it up on here. So just please feel free to check Shots for School first. Next slide, please. This is just a screenshot of the different school reporting sites that we have. If you're a smaller school, some of you might be reporting for all of these cohorts. So you know that it's a separate site for each. Even if you are just a school that has preschool and kindergarten, please remember that you do have to sign into a different site each time and report separately. Next slide, please. And once all of our school reporting data is in this year, the school reporting deadline is January 31st. It is later than most years because we opened a bit late, and we want to make sure that we gave you guys extra time to accommodate for 1st and 8th grade reporting as well. But on the Shots for School site is really a lot of information and historical data that we've been keeping for years and years. And one of those resources is the school reporting map. So you can actually look up your zip code and see how other schools are doing around you. We post what we call as the up-to-date rate. And in addition to the up-to-date rate, we also have the vaccine-specific rates. And the up-to-date rate reflects the number of, or the percent of students who are fully vaccinated. And this doesn't have anything to do with compliance. It is just showing the percent of fully vaccinated students. Next slide, please. And here's how you would see the additional school reporting data. If you're curious, you can click by cohort. I just used kindergarten as an example. So if you click the K through 12 tab, and then on the left-hand side, clicked school reporting data, you'd be able to see our summary report, the data, the line list of schools in both the PDF form and an Excel form, if you want to sort that out. And then there's also a link to the map. Next slide, please. And then the final bit of this is where this data all goes, it all gets crunched down to this one line in the CDC report. Next slide, please. In addition, school reporting data is so important because we use it to inform a lot of choices. For example, legislation change, and that has led to all of the important work by Joan and others. So if you see here on this red box is the medical exemption information. So they have these exemption FAQs that are updated pretty regularly. And then there's also the initial school and childcare webinar presentation that's there for your use. Next slide, please. And these are just the emails for all the CDPH different school inboxes. If you have any reporting related questions, please email schoolassessments@cdph.gov. Any requirement related, there are shots for school. And then medical exemptions has their own specific inbox. And depending on the season, these inboxes have about a 2 to 3 business day response time. So please be patient. Thank you so much.
Great. I want to thank our speakers. Thank you so much to Pamela, Joan, and Kristen for such interesting and timely updates on many school immunization issues. And if our listeners have been waiting patiently to ask a question, and I don't think everyone's been patient because there's been a ton of questions come in, and I want to thank everyone for submitting questions. So again, if you have not yet posed any questions you'd like to share with us, you can put them in the chat or the question box. And while we're giving everybody a moment to just collate their questions, I would like to remind you that following this program, an evaluation will pop up on your screen. We truly appreciate your responses. The California Immunization Coalition produces at least 3 to 4 education hours per year, and we rely on your feedback for improving these calls and for preparing future topics. So we do really appreciate your feedback. Okay, so we have lots of questions coming in, and many have come in just the last moment. So I'm going to start with 2 that I can dispatch very, very quickly, and then we'll get on to our speakers. One of the questions was, if a child has chickenpox, do they still need a medical exemption? In the past, as you guys know, we just used labs to confirm that a child was exempt from having the chickenpox vaccine if they had positive titers. But going forward, a physician will need to submit for a formal medical exemption through the CARE-ME process, and the reason for the medical exemption would be has had disease or has positive titers. Another quick question is, can children apply for religious exemptions? And we no longer allow for religious exemptions in California. It continues to be an ongoing issue and challenge with respect to adults who can apply for religious exemptions. So moving on to the more meaty questions that the speakers have great expertise on. I know a lot of questions came in on this. Joan covered the situation with IEPs and our children with IEPs exempt from meeting immunization requirements. And while the content was covered, there were a lot of questions on how do parents initiate the appeals process and how do they access the form. So Joan, can you reinforce how parents access the form?
Yeah, thank you. There's, when you go to the, maybe we should pull up the form, Cameron. I think you already had it open. There's there are detailed instructions, but I don't think that's it. It's the appeal form. I thought you had it open on the, sorry, I can't see it. Can you scroll down? Is that the one with a lot of pages?
And if possible, I don't know if we can send this form out. If we're able to send this out to our participants, we'll do so.
Okay, can you just, would you mind, Cameron, just clicking on the instructions and appeal form? So this is a very long document that has detailed instructions and the form on it and specifically steps how to do that and how to appeal. And that will be available once the video, then this video will be posted on the website. And maybe you can just scroll down a little bit so people can see kind of what's in there. And you can see there's a part to be completed by the parent or guardian and a part to be completed by the school, because you have that immunization information. And there are very detailed, clear instructions about how to do that.
Thank you. Okay, couple other questions came up that are somewhat related. And this has to do with the timing for reevaluating exemptions. Can you please, so for medical exemptions that were issued prior to January 2020, are they valid until the next checkpoint grade?
So
Okay.
ones that have, I'm sorry, were you finished?
Or can you confirm that a permanent exemption is valid until the next grade span is reached?
Okay, so assuming that the exemption was not written by a disciplined physician, it's valid until the next grade span.
And then speaking, another related question, the way the question was written, can we revoke a medical exemption if the issuing doctor has completed probation? And I think I'd like to reframe that a little bit, because we in public health and we in school nursing, does not fall to us any longer to determine whether or not a medical exemption is valid or not, which I think is one of the great things about this new law. The decision has been taken out of our hands, and it's now being adjudicated at CDPH with a highly trained specialized panel. But what's the timing for a physician who has been on probation and now they've completed their probation? Are their medical exemptions now acceptable?
So any physician who has been disciplined for any reason cannot write a medical exemption. However, just in terms of logistics, there's not a however about that. We only are looking at the ones that have been revoked that CDPH has asked us to go through and revoke for them prior to the creation of the database. From the time of the creation of the database, all medical exemptions must and can only go through CareME. So there will not be a concern on our part if a physician is now allowed to write a medical exemption, because it will go through CareME. At the moment, physicians who have been disciplined don't have access to CareME. Should they be granted access to CareME again, that will go through the California Department of Public Health, and they will make the determination. So we will not have that responsibility or be burdened with that task anymore. I hope
Thanks,
that
Joan. And then one more fairly related question. Just to be clear, there is no difference between a physician who's had a license revoked as opposed to had a disciplinary action against them as far as their MEs being unacceptable.
Correct.
Thank you. And I have a couple questions I'd like to throw to Kristen. So here we go, Kristen. So a couple questions came in about please direct our attendees to the school reporting website where they can add schools.
So at the moment, the way the school reporting website works is we populate it every year from the Department of Education and the Department of Social Services. At the moment, schools cannot add themselves to the directory because we're using specific information from the official databases. And we pull this information at the beginning of the fall. So sometimes it is updated by the time the school reporting site actually opens, and in which case you can email us schoolassessments@cdph.gov and we can see what we can do. But in all honesty, just try logging in first, because a lot of times these databases are updated in our site already.
Okay, and another quick one for you, Kristen. Is the CareME site, or is the CareME process in place for childcare centers beginning January 21st as it is for schools?
Yes, it is to be used for all students now. And in the school reporting side of things, it's the same. You would report it as normal, except for schools and childcares are now no longer checking if it's valid or not.
And then this question, I'm not sure whether this one might be more appropriate for Pam. A couple questions came in about the McKinney-Vento Act, and are homeless children required to have vaccinations? When can they be excluded?
After, if Pam has something to say, I have something to say after that.
I do. Here's the deal on McKinney-Vento. Just because a child is homeless does not mean that they are excluded from or just excused from getting vaccines. Having said that, it is a problem, and I know that some schools where I work have been cracking down on it. You are to make in the district every effort and keep making the effort to connect those families to vaccine providers. Can you exclude them legally? Yes, you can. Should you exclude them? That's a different topic because, you know, these are homeless kids and school is clearly the best place for them to be. I cannot give you a black and white answer on that. Maybe Joan has more wisdom than I do.
Well, I don't know about wisdom, but, and I didn't put the name of it. I just posted the link to the CDE information, full information on McKinney-Vento. One of the things that I wanted to mention that I know that has been of concern and has been happening in districts is that there are mainly counselors who are asking school nurses to identify students as homeless so that they don't have to be out of school anymore, and they can bring them back in and call them homeless so that they don't have to get their vaccines. We don't do that. There is a McKinney-Vento person at every single school district who oversees McKinney-Vento. They will have a list of students who are considered homeless. You don't get to add to that list.
Mhm.
You find out the list. And so please just tell anybody who asks you to do that. That's not your, again, don't engage with, that's not my responsibility. I don't have the authority, not my responsibility. Refer them to the McKinney-Vento person. You don't have to answer those questions. And there's someone at your school district who can answer those questions for you when they come up.
All right, I think we're doing pretty well on our questions. A lot of questions came in about will slides be available? And I know we posted a link that was a little bit problematic. It's been reposted, but I just want to remind everybody that this entire program, including slides, will be posted on the CIC website. And I've saved one question for last. We've been asked for comments on a potential COVID vaccine mandate and how will this be handled in the CARE-ME process? I have a feeling the answer is we don't know, but would anyone like to take a stab at that?
I would like to say two things about that. One is I would like to confirm we don't know. Although if it is going to be an exemption, it will have to go through CARE-ME once it's mandated. But I was aware that another question came up having to do with will we have personal belief exemptions again or not? And just to be clear, if it's mandated not by the legislature, then yes, there will be personal belief exemptions, most likely the way we did them before, and those instructions would come out. If it goes through the legislature with language that says it will be the same as other requirements and no PBEs, then no. So there's two different pathways depending on how the mandate comes through. And we'll be watching this year what goes to the legislature.
Meg, this is Catherine. I just want to add, it's a very dynamic, as you all know, it's a very dynamic, fluid situation. And we will do our best as a coalition to keep everyone apprised, especially after the first of the year. I think more information will be coming out and we'll see how things go, but we're going to do our best to keep everybody informed and up to date.
Thank you, Catherine.
So I'm sorry, I just want to point out, since it just came up, we're very fortunate to have Dorit Rice in the audience. And as she points out, the districts are different. The districts who have mandates now, they get to choose their terms. That has nothing to do with the state mandate. Thank you, Dorit.
And thank you so much, Joan, for acknowledging Dorit being on the call. There were a couple of very valuable comments here that we're not going to have time to share, but we do anticipate setting up another webinar in the future to deal with more legal issues having to do with school requirements and masks and immunization mandates. So please stay tuned for more valuable content on that. And I want to just once again thank our speakers. We are so grateful to have both Pamela Kahn and Joan Edelstein, as well as Kristin Finch, for their presentations. We also want to thank the members of the CIC Education Committee for their support in planning and coordinating the call. Very big thanks for all of you for spending your hour with us. Please remember to fill out the evaluation form that pops up on your screen once the program concludes. And again, you can find a replay of this webcast as well as our previous webcasts on the CIC website, which is www.immunizeca.org. Look under the resources tab, then click on the education hour and you'll find them all there. So thank you all again for joining us. Enjoy the rest of your day. And again, happy holidays from all of us here at the CIC.